Well, joining me via Skype is a public health physician and PRO Association of Public Health Physicians of Nigeria, Dr. Oluwatoyin Adeyemi. Good morning and thank you for joining us on TVC Breakfast.
Good morning. Thank you for having me.
All right. Government has put in so much effort towards curtailing the spread of COVID-19, yet we are beginning to see a continued spread of the virus, especially community spread, so to speak. And this is raising concerns. From your point of view as an expert, what is at the heart of this community spread?
Well, initially when we started having the imported cases, it was limited to some particular geographical location. However, local transmission and community transmission has started. Before that time, the government and public health authorities had already instituted public health measures, which include social distancing as one of the main key strategies that we had to help us curb the menace. However, after the lockdown started, first of all, it wasn't a national lockdown, but after the lockdown started, also in Lagos State, a lot of people did not comply. We still had a lot of people gathering, and it wasn't just the semi-literates or illiterates that were doing this. We also had people that are supposed to be knowledgeable who were also gathering in the name of exercise or soccer. So we had a lot of flouting of this government and health regulations in so many communities. So this affected greatly and it contributed to community spread, which we are now saying rampant. As of today, now we have 407 cases, and most of them are local transmission and transmission that cannot even be traced at all for now.
Do you think that this is because a lot of persons do not still understand what COVID-19, how it is spread, or are not well educated and enlightened with regards to the spread of COVID-19?
Well, from the feedback gotten at the community level, because we're involved in a lot of community engagement, we found out that a little percentage are not aware at all, even though most people now at least know that there's something called coronavirus, because they are stuck at home and they are asking questions. Why am I at home? Why is the government locking me down? So a few of them have knowledge of this. However, because of the hunger in the land, as problems in Nigeria are multidimensional, so a lot of people, despite being aware and despite knowing the repercussions of some of their actions, they still go out because they need to eat. And these palliative measures that have been instituted by the government are not currently, they are not reaching most of those people. Thankfully, we had a press release last week which has tried to decentralize this process. So some of these food items will be given to churches, will be given to mosques, will be given to community development associations, and so on. So I believe with some of these measures, the people can now abide and stay at home and also observe all the other sanitary measures that have been put in place.
Now that the lockdown rather has been extended by 2 weeks, what would be an effective way of exploring community communicators as well as understanding the needs of communities to effectively pass the message across so that the essence of the lockdown would be achieved?
Even before COVID, there has been a strong community engagement between members of the health sector, the government, and communities. They already have established link. Prior government had instituted things like the Community Development Association, Community Development Committee. So there had been several engagements with these people, but more of this will be needed right now because we need their members to cooperate with government. So there will be a lot more community engagement. And for the benefit of a few people that do not have this information yet, other forms of reaching out to them will be explored. Like you could have a motorized campaign going around into communities that are hard to reach. We could have localized methods like a town crier going around just to ensure that nobody is left out and everybody has this access to this information and what is going on out in the public. So community engagement using informal sectors, our market women, transport associations, youth association, women association. So all this will be explored such that everybody understands the benefits of what we're trying to achieve, why there's a lockdown and what is available for them, even while we tell them to stay at home. So there'll definitely be lots more community engagements in the days to go by.
All right, Dr. Oluwatoyin, thank you for speaking with us.